Well, lucky you. You guys get to talk, sit down and hear about 2 hours worth of some crazy stuff. But I think it's good. It's good to have everybody be prepared. I too am going to start with a video. I guess mass shootings are kind of similar in the way you present them. And I'm going to try not to fall off this thing. I think there's an orthopedic surgeon in the room, probably, because this is like the house of God. This is like orthopedic height, so perfect height for your hip.
Why are the people laying on the ground? Why are the people laying on the ground?
It's 10 p.m. and more than 20,000 people are watching country singer Jason Aldean at the Route 91 Harvest Festival. Across the street, the gunman Stephen Paddock is in a corner suite on the 32nd floor of the Mandalay Hotel. He planned his attack meticulously. He had assembled an arsenal, bolted an exit door shut, installed surveillance cameras in the hallway, and calculated his elevation and distance from the crowd. A few minutes into the show, Paddock fires what appear to be single rounds from his hotel room. Video timestamps reveal that this happened after 10:05. Why doesn't Paddock fire more rounds at first? There are at least two theories. He's checking that the range and trajectory of his gunshots match the calculations he made, or he's firing at fuel tanks in the nearby airport. Whatever the reason, an uneasiness fills the crowd and people move toward the exit. 30 seconds later, we hear what sounds like automatic gunfire. It's the first of 12 bursts Paddock fired at the festival. More people begin to leave at the rear, and lights are turned on. Around the time of this first burst, security officer Jesus Campos is looking into a separate incident when he happens to come across the door Paddock had sealed shut. Paddock appears to be alerted to Campos as he is leaving, and fires through the hotel door, wounding Campos in the leg. Campos takes cover in a doorway and calls in the shooting on his radio. The police and armed security officers begin to respond from within the hotel. 36 seconds after the first burst, Paddock fires a second one into the crowd. The cracking sound you hear are bullets passing nearby. The intensity suggests Paddock was aiming very near this area by the front of stage, the densest part of the crowd. There is a short interval here of 17 seconds. People begin to flee again. But then a third burst of fire opens up. The changing pitch of the crack suggests Paddock is spraying the bullets around the area. A fourth burst hits the crowd just 20 seconds later. By our count, Paddock has now fired over 300 rounds in less than 2 minutes. The scenes that unfold at this point are distressing. There are multiple injuries stage left, and people begin to treat the wounded around them. At this point, there's a break in the shooting of almost 1 minute and 50 seconds. We don't know what Paddock is doing during this interval. It's possible he fired down the hallway again. We have reporting that by now, Campos has been joined by hotel engineer Stephen Shook, who reports gunfire on his hotel radio.
It's at the end of the hallway. I can't tell you what room. He looked like he fired down the hallway when I got close to the door.
Whatever the reason, this break in the shooting allowed many people to move to safety. At 10:08, a police car arrives along Las Vegas Boulevard. A minute later, police officers are moving along a wall in the direction of Mandalay Bay to get eyes on the shooter. They direct fleeing concertgoers back into the venue and away from gunfire.
Hey, you guys! Get down! Go that way! Get out of here! There's gunshots coming from over there!
Then Paddock fires a fifth burst. It's around 22 bullets in 3 short volleys. We hear this same burst from a different angle. At the Mandalay, where cab driver Corey Langdon was filming. Here's what it sounds like up close. Our reporting suggests that Paddock was positioned directly above the camera at this point. Then, just 40 seconds later, you can hear very dull and hollow gunfire.
Now it sounds like it's coming from farther away.
These rounds were not picked up by cameras recording in the festival at this time. That, plus our additional analysis, suggests this is Paddock firing indoors again, possibly toward Campus and Shook, who are still in the hallway. This lull in shooting outside lasted just over a minute and allowed more people to flee. But then, a sixth burst of fire. "20 seconds later, in a seventh burst, Paddock appears to take aim at the police. Just 20 feet away, more police are taking cover behind a patrol car. They take direct fire and call it in over the radio. It's now been over 6 minutes since the shooting began, and the area at stage right is mostly empty. But people are still taking cover at stage left when Paddock fires an eighth burst.
Should we get up? Should we get up?
'Get down. Get down, Nick. Mike.
Meanwhile, at the Mandalay, Paddock fires a ninth burst of fire right over a line of cabs and into the crowd. Taxi driver Corey Langdon still sees no signs of panic.
Where are the cops at? I'm right here by the porch at Mandalay Bay, and everything just seems to be normal here.
And hotel guests are still by the lobby.
You guys, there's a shots fired.
But actually, police were there. Up in the hotel, 2 officers are closing in on the gunman.
I'm inside the Mandalay Bay on the 31st floor. I can hear the automatic fire coming from one floor ahead. One floor above us.
And even as police are responding both inside and outside the hotel, Paddock unleashes his 10th burst of fire. More police cars approach along Las Vegas Boulevard.
Control, we need all units stop coming northbound on Las Vegas Boulevard because he's shooting this way. It's a horrible cover fire.
Further along, people are fleeing through the rear between bursts.
Keep your head down, run this way.
Nearly 1 minute and 10 seconds pass before his 11th assault. By now, Paddock is no longer firing in long, steady bursts.
Keep your head down, run that way.
We don't know why, but he may be struggling with a sluggish weapon or using a different gun. He fires his 12th and final burst as Corey Langdon leaves the Mandalay. It's less than 50 rounds. The rate of fire slows, and at 5 seconds it's the shortest of his bursts.
All the taxi drivers are gone now.
It's 10:17 and concertgoers are still fleeing at the far side of the venue.
Is there somebody out there?
Yes,
You know what's happening. All right. Go. Okay.
12 minutes after the first bullet was fired, police close in on the gunman on the 32nd floor.
Control 590, I have a team of 4. We're going to make entry to the site. We need to make a contact to the suspect. See if we can get up to him.
We're 69, we're doing that right now. 32nd floor.
Copy. We're going to make our way to give you support.
By now, Paddock is no longer firing on the crowd, and police continue to move closer to his room.
42, I'm in the stairwell on the 32nd floor.
They evacuate guests.
Control 159, we're doing evacuations as we're working our way down the hallway. We're about 1:30 and on the suspect's door. I need everybody in that hallway to be aware of it and get back. We need to pop this and see if we get any type of response from this guy. And see if he's in here or if he's actually moved out somewhere else. Breach. We are clearing this room. We have one suspect.
The police find 23 guns and hundreds of rounds of ammunition inside Paddock's suite. By our count, he fired close to 900 rounds at the festival. The police say he fired another 200 into the hallway. Paddock was found dead from a self-inflicted gunshot. The 64-year-old killed at least 58 people, and over 500 were wounded. It was one of the deadliest shootings in modern American history.
Good kind of overview of that night, kind of drags a little bit of emotion into this lecture, kind of shows you the scope and size of what we had to deal with. So goals and objectives, I know I saw some fellow knuckle draggers in the back, you know, firefighters, paramedics. You're gonna talk about the challenges that affected them that night, talk about the challenges that affected the healthcare that night with a number of victims, and lessons learned pretty much all around. All right, so a little bit about Route 91. So Route 91 Festival is a festival that occurred annually on the Strip. It's basically 17.5 acre in size, used for multiple events. There's about 22,000 people the night of the shooting. So overview of the Las Vegas Valley. You can see the airport on the right-hand side. You can see the Mandalay Bay that basically is on the South Las Vegas Boulevard. The venue is here in the yellow. That's right across the street from the Mandalay Bay on Las Vegas Boulevard. This is important too. You can see the venue, and you can also see the fuel tanks in the back. His initial shots were at those fuel tanks. So he was trying to ignite those fuel tanks to keep people inside of the venue. A picture right before the shooting. This is the village. So the village where the shooting is, you can see the stage over there, and you can see where Gate 1 and Gate 7 is. But you'll see a little bit of kind of cloud of war or fog of war of what they call it when the shooting first started happening, because Jason Aldean was on stage. When the shooting started, he was rushed off stage, but his mic was still hot. So all of the shootings that he was hearing or that were going into the crowd was being echoed in and throughout the microphones and the speakers. And so people thought that there were more than one shooter instead of just one shooter in an elevated position.
Dispatch, Engine 11.
Engine 11.
Dispatch, you got a large crowd running from the music festival down here. Do you have reports of anything? Sounds like gunfire.
That's a negative, sir.
So this is from Las Vegas Police Department. Again, we talked about the fog of war, also talked about those active speakers that Jason Aldean had that caused some confusion inside the fairgrounds.
16910 means we got shots fired, 4:15 ASF. Route 91 sounded like an automatic firearm.
Copy, code red at 169 Sam means they have shots fired.
179 means is coming from upstairs in the Mandalay Bay. Upstairs in Mandalay Bay, halfway up. I see the shots coming from Mandalay Bay. Halfway up. Control 361, I see. We have multiple 415A breaks. Give me a surge. We have an active shooter. We have an active shooter inside the fairgrounds. 17910 means that is going to be a light on Mandalay Bay. Not shots up from the Mandalay Bay, but it's coming from that direction.
Oh, that is correct. Shots fired from Mandalay Bay. There's many people down. Stage left. Just be advised.
CP, I need eyes. Somebody in the CP, can you tell me where it is coming from?
We're getting it from Mandalay Bay.
Somewhere in Mandalay Bay. It's at the intersection. It almost sounds like it's that close.
Arriving unit is coming across from the boulevard, so look at it and be careful. It sounded like an elevated position that they had.
790 arrived. I'm going to form a strike team. Mandalay Bay and the boulevard. I need 5 officers on me. We have multiple casualties. GSWs at the medical tent. Multiple casualties.
Control, be advised. Shots are coming from...
So you can see, you know, the confusion and stuff that was taking place that night. That's kind of normal in something like this. I mean, you'll see later with the number of distraction calls, and you know, for all of our first responders and stuff out there, what our distraction calls mean for us, and how we respond to those distraction calls, and always the worry of this being kind of a multiple shooter Mumbai-style attack. So in the yellow is basically the effective range of an AR-15, about 800 meters, and in the red is the effective range of an AR-10. Collection centers were set up in areas that were considered a hot zone. So the command post, actually the United Command Post, is on South Las Vegas Boulevard at Station 11, and that was away from his effective range. You can see the fuel tanks. There's also executive hangars over there. We'll talk a little bit about those executive hangars, a couple more slides. Route 91 casualties, so these are our most recent numbers. So more than 800 patients, pretty much from all over the place. More than 422 people were shot, over 500 total gunshot wounds, 58 people were killed. So when you look at the number of shots that he fired into that type of a crowd, to only have 58 people killed, it really goes to a testament of all the men and women and people that worked that night to save lives. So 13 area hospitals, more than 250 patients were transported by EMS. So you kind of do the math, so roughly about 80% of the patients were transported to local area hospitals by private vehicles. So when we learn about mass casualty incidents, we have an incident, we control the incident. EMS does a great job of sifting and sorting and triaging to various hospitals, trauma centers, the things that make a little bit more sense. But when you have 80% of these people that are transporting themselves to the hospital, some of them to not trauma centers, it could really overwhelm a hospital system. So when you talk about preparedness and things that you're working on in your communities, one thing that we're working on is similar to like the white plan that the French do, is a hospital response team. You know, because we lucked out with our response. A lot of hospitals lucked out because of our response, is basically having that pre-hospital EMS resource to go into a distressed hospital and help you manage the influx of patients if you didn't have enough people. So basically, it occurred in Clark County, but City of Las Vegas, Henderson, and North Las Vegas Fire all participated. I'm not going to go through this entire list, but all the medics and firefighters back there, I mean, that's a lot of personnel on scene. So a lot of people worked really hard that night. So 9 hours and 27 minutes on scene. Challenges for first responders. Victim egress. I mean, kind of similar to Orlando, when people egressed out of the nightclub and went in all different directions. And you'll kind of see what happened here. That kind of also is challenging when you want to set up a collection point, a collection center in a typical MCI. Engine 11 was coming back from a call. As soon as they started seeing patients, that was their collection center. It happened right then and there. Distraction calls, again, this could have been a Mumbai-style attack. So what began at like 17.5 acre site soon spread out to more than 3.5 square miles. So this was the largest crime scene since 9/11.
Command, Engine 32.
Engine 32, you have a division supervisor. What do you need?
En route to my division chief, we've been flagged down. We have a victim shot in the neck in front of Hooters. I need an ambulance here, please.
Copy that.
Make that 3 ambulances total. I have 3 total gunshot wound victims in front of Hooters. Command, Engine 32.
Engine 32.
Yeah, Chief, I have a total of 6 gunshot wound victims here. I have 1 patient that's been brought up that is 419 in the vehicle. We're going to need Metro to secure the scene. We're going to need 2 additional fire department units and a total of 6 ambulances.
So again, Engine 32 was heading towards their collection center. Well, guess where their collection center just became? Right there. I mean, that traffic was traffic in less than a minute. So it went from 1 victim to 3 victims to 6 victims, and that's how fast this accelerated. This is cell phone data. So this is about 22,000 dots of everybody's cell phone kind of in the fairgrounds itself before the shooting started. And you can kind of see where the Tropicana is, the South Las Vegas Boulevard. This is when the shooting started. So 3.5 square miles. You know, people egressed everywhere. The main egression basically was northeast. which kind of made sense to my hospital, Sunrise Hospital, how we receive so many patients.
Jesus Christ, that was real?
Oh, yeah.
That was real? What's going on?
This is the fairgrounds. This is the basically the initial people that died on scene that weren't able to be transported out from those scene. And you can also kind of see on the road behind that, that's Koval Lane. Some people were dragged and taken out onto that street. They passed there. And this is kind of just an overview showing the Tropicana and some of the other victims that died there on scene. I talked about the hangar, right? So everybody egressed in every area, right? So a bunch of people tore down the fence going into McCarran Airport. They broke into the executive hangar, and that's Sheldon Adelson's jet. And by the time police arrived to clear the area, the cowboys, some of the cowboys climbed into his jet and drunk every single bit of alcohol in his jet. I mean, I don't blame them, right? So, distraction calls. We learned about the Mumbai-style attack, and unfortunately, hospitals are going to be targeted if this ever were to happen here in the United States. And this is kind of what happened right after the incident. And this is important for you and your hospitals to kind of prepare and make sure that your security is sound during a mass casualty or mass shooting.
North Division, go ahead.
Hey, Chief, we're getting reports from bystanders that they saw somebody go into an RV directly across the street from where we're at, wearing fatigues and a black duffel bag.
Lion 6, be advised we're getting reports on Mandalay Bay, the top of Mandalay Bay at the bar. We currently have another active shooter up there. I have reports that there's an active shooter at New York, New York, and shots heard from Hooters.
We have reports of active shooters now at Hakkasan and New York, New York. I have not confirmed that.
Also getting reports that shots are being fired at MGM as well. Shots fired at MGM. We now have report of an active shooter at the Tropicana, active shooter at the Tropicana.
Command from North Branch, emergency traffic. We have people on the roof of the Tropicana, at least 2 people on the roof of the Tropicana.
Emergency traffic, shots fired in the Tropicana. Shots fired in the Tropicana.
Command from North Branch, we're getting people evacuating out of the Excalibur, reporting that there's a fire in there. Chief Blackburn's receiving reports of shots fired in the Planet Hollywood, and I see strobes going off inside of the Mandalay. Chief Blackburn just came in here. He's reporting shots fired at Caesars now.
Be advised, we are currently receiving reports of an active shooter at McCarran Airport. Repeat, active shooter at McCarran Airport. And be advised, we're getting reports on the 34th floor of Mandalay Bay. There's been an explosion in the 32nd, 33rd, and 34th floor on fire.
Over there.
Command, we just had a shock pack show up unattended right where EMS branch is set up at Alibaba and Giles. We're relocating from the area.
Command operations. Also, we're getting reports of hostages being held currently at New York, New York.
Emergency traffic, Force Protection 6 is reporting shots fired at the New York, New York.
That's pretty crazy, right? In every single one of those calls, a MACTAC unit had to be sent out to clear that space. I mean, basically what happens is you've got 22,000 people who are just shot at. Some of them have blood all over them. They run into the Tropicana, MGM, whatever. I mean, people are going to think that there's an active shooter right outside there. But what does that mean to us in Las Vegas right now? So, I mean, we kind of set the bar of seeing that many patients in that short amount of time. We're planning for this now, unfortunately. We see 40 million visitors a year, and this, unfortunately, is something that we need to start being prepared for. We already are prepared with our local law enforcement, but something like this can happen, so we're just kind of looking at all of our plans. So again, collection areas and patient egress was an issue with our first responders. Basically made all the hospital response really overwhelmed some of the hospitals. Everybody there was practicing basically in a warm zone, and then our distraction calls. So this is my team at Sunrise Hospital. There's guys in the black are actually pediatric surgeons, and that's kind of important as we go to how we survived that night. This is a map of the Las Vegas area. You can see University Medical Center, that's the level 1 trauma center. Sunrise Hospital is a level 2 trauma center, and Desert Springs is a non-level trauma center. The side of the MCI, important to see that basically the egress of the patient is kind of taking them towards Desert Springs, taking them towards Sunrise Hospital. Quick drive. I was at home and got paged when this happened. Obviously, started getting texts, and I just drove right in. Pretty much 5 minutes after the first text message, and what I saw was basically an ambulance bay or a hospital surrounded by private vehicles, Ubers, pickup trucks. Something that was absolutely nuts to see. So actually, on that one there is if you use Google to ask you, or Siri to ask you where the local nearest hospital is, it takes you to Desert Springs Hospital and Medical Center. So that's why a lot of people ended up there. So Siri doesn't know the difference between a trauma center and an ER. So probably use Google. There you go. I'm not just going to talk about what our hospital system did. I definitely got to give kudos to the entire Valley hospital system. Everybody took care of patients that night. So this is the Valley Health System. This includes Desert Springs, and Desert Springs is on that list of hospitals that saw 93 patients. They are not a trauma center. And they saw 93 patients. They did salvage surgeries. They transferred those patients the next day to the area trauma centers. Dignity Health, 87 total patients. This is the level 1 trauma center, University Medical Center. 104 patients. You can see kind of how the egress of the patients went. Also, too, the police cut off I-15, which is how you would get to University Medical Center, and that affected the number of patients that they saw. However, they did a fantastic job, 104 patients, and primarily, we couldn't take any more transfers at the end of our night. So they took all the transfers from all the other hospitals that needed to be taken. This is our hospital system. So we have 3 hospitals in our hospital system. Southern Hills, small area hospital, 12 patients. Mountain View is farther out, only 8 patients. It says 212 there, but we just went through the video. It's about 260 because the 50 other people that had shrapnel wounds or scrapes and bruises and all that kind of stuff, they just left. So 16 hospitals participated that night. 639 patients were treated at only 3 trauma centers in the Valley. Only 14 people died if they entered the hospital alive. Pretty amazing. So Sunrise Hospital. So Sunrise Hospital, interesting fact about Sunrise Hospital used to be in an affluent area in Las Vegas. It's now in the hood. It was funded and built originally by the mafia in Las Vegas. So there are bodies buried underneath the parking lot. It's a huge hospital, 167 ED visits, about 115 visits on the adult side per year. We do all of this on the adult side out of basically a 45-bed emergency department. And that's what we had to deal with that night. So it's going to be pretty interesting for you to see how we grew the footprint of our ER, utilized every single ground floor space, and that's something that you'll have to put in your plans as well. So of the 212 patients, 30 were unidentified, 92 patients came in without identification. And this is interesting, and those that went to the concert, you couldn't bring your purse in there. So, that causes a huge problem. People did not have identification, especially the ones that arrived DOA for us. We had to identify them by tattoos, what they were wearing, what color their boots, basically recent Facebook pictures. It was really difficult to get our head around identifying those patients. So 64 admissions, 31 patients went to the ICU, 83 surgeries were performed, 516 blood products were administered. So 31 people went to the ICU. I guarantee we would have had more deaths if it wasn't for the response of our nurses, our staff, our physicians, our local EMS agency, if they didn't come in and go to work that night. So, Yeah, all the nurses are laughing at that one, right? So part of your planning should be, what are we going to do with the patients that are in the emergency department if a mass casualty incident were to occur? So what did we do? So we basically moved all of our admitted patients upstairs. There wasn't, hey, he didn't call report, anything like that. I mean, they just went straight upstairs. We segregated all of our active patients in one part of our emergency department to make sure that we didn't, miss any acute injury or anything that they were to have. And we moved all of we're in Las Vegas. We've had a bunch of drunks and all that kind of stuff. So we moved them down to the behavioral health unit. But really, actually, when the patients were looking around that were actively there, if they weren't shot, they just got up and left, except one guy. So I'm running around the emergency department trying to make sure everything was good, make sure our doctors had the equipment that they needed, make sure the patients were taken care of. And I see this guy, didn't look like he went to a country music festival, but anyways, he was limping. And I'm like, sir, were you shot? Were you shot? You're limping. And he's like, no, I wasn't shot. I was at Walmart and a shopping cart hit me in the leg. So I got the chance, and not on my last day right before I retired, to say, unless the shopping cart shot you in the leg, you get the fuck out of my yard. So, definitely, I mean, if you can't laugh about this shit, right? Whatever, horrible night, but you got to laugh at it, you got to learn from it, you got to move on. 100 physicians and APCs showed up, 200 nurses and ancillary staff showed up. By the time we had all the nurses arrived in the emergency department, basically every patient had their own nurse. Awesome, right? This was my team, 20 emergency physicians and APCs, 3 hospitalists, and you'll see how they kind of cleared out the hospital here in a second, and 18 scribes. I mean, these are 18 to 20-year-old, pre-medical students. They haven't even seen the world yet, and they had to witness that night. So we'll go through this timeline really fast. 2205 was the first shot. 2225 was the first POV. And when you talk about POV, this is POV with 4, 5, 10 patients in the back of a truck. And also, when you talk about ambulances, unless they were actively coding the patient, ambulances had 5 to 6 patients in the back of their ambulance. So the administrator on call, we'll talk about him a little bit later too. No administrators in the room? So. All right, you'll probably understand this one. So our first patient was triaged to the ICU at 2,300 hours. And this is really fast. You're like, how did you triage people to the ICU that fast? Any neurosurgeons in the room? Proves my point. The albatross of surgical specialty is a neurosurgeon. Except on October 1st. We had 4 neurosurgeons that came in, and they're like, what do you want me to do? Where do you want me to go? We had just isolated GSWs to the head. They didn't need to go to the OR right away. They went straight upstairs to the neuro ICU, and at the bedside was 4 neurosurgeons. Pretty amazing. Yeah. So first 5 damage control surgeries were completed by 2359. This is kind of the guess of timeline of when everybody all arrived. Because the amount of surgeries that we did was truly amazing. And it was amazing because we only have 7 trauma surgeons. So we had pediatric surgeons doing XLAPs on adult patients, pediatric cardiothoracic surgeons doing open thoracotomies on adult patients. It was a true team effort. 167 discharges from the hospital. So that's my team, right? So 3 hospitalists discharged 160 patients from the hospital. So now they don't have an excuse during flu season when they don't do that shit. So 56 surgeries basically in the first 24 hours. This is actually, we just got the video back from the FBI and painstakingly went through the video footage of that night. And this shows basically arrival pattern by minute. So you can look basically your first hour, you get pummeled. So again, if this was a Mumbai-style attack where there's multiple phases, multiple shooters, and multiple areas and multiple time frames, you can just expand that. So, oh yeah, where's the administrator? There you go. Okay, so administrator on call, 2345. ER opens to normal operations at 11 o'clock. However, the administrator on call asked me at 6 o'clock, can we open up for normal business? So after I went through the checklist of how much blood do we have any more dilaudid, Zofran, surgical equipment, or our CT's on fire from scanning everybody, so he did his due diligence, went and make sure everything was operational, and then we opened up at 11 o'clock. So 124 gunshot wounds. So this was an elevated position, so people were shot everywhere, foot, hand, head, whatever. Basically the chest, abdomen, and head were our most severe GSWs. It kind of breaks down kind of what we saw within the additional surgeries, breaks down the number of blood. And actually, you look at the waste, out of 516 units of blood, I mean, that's not a lot of waste. So that's pretty good. This is, again, arrival pattern. We didn't have time to tag people. The normal MCI, you're, red, you've got seconds to minutes, yellow, you've got minutes to hours, green, you're walking wounded, black, you're DOA. We didn't have time to tag people. I mean, basically, we brought down all the ground floor assets, all the assets to the ground floor, gurneys, all that kind of stuff. And we started to segregate our emergency department. We're going to put the reds in this area, we're going to put the yellows in this area, we're going to put the greens in this area. Great idea until 260 people arrived. So yellow arrival pattern, green or ambulatory arrival pattern. Talked again about this. So this is our footprint of our ER. So you can see the adult emergency department over there. The peds emergency department, which is not part of us, is adjacent to it, and then the PACU. On New Year's Eve, we have kind of a practice surge capacity every New Year's Eve because people somehow go to Las Vegas and get drunk. So we've grown our ER into the PACU space before. So that was the first place that we moved into. So we moved into the PACU, then we moved into the PEDS ER, and I'll show you the breakdown of kind of how we triage that just to kind of make sense in your head of what type of patients you need to be putting in what areas. So in our emergency department, we had the red area, which is by our trauma bays. We only have 2 major trauma resuscitation bays. So we use that plus what we call Station 1 to put all of our patients that may need surgical assets right away. So these were our patients, our sickest patients. These were the ones that needed to go to the OR, needed to have chest tubes, intubations, et cetera, that were highly unstable. They were closest to our anesthesiologists and our surgeons, who our surgeons basically would then triage what patient needed to go to the OR from there. Down on the south side, and basically would be the west of our emergency department, we started putting our yellow patients. So any other given MCI, these yellow patients would have been red patients, but they weren't actively gonna die right away. So that's where we did airway control, we did chest tubes, we did, started blood and all that kind of stuff. And it was basically a triage and an over triage and an over triage, because as soon as those interventions did not work and they declared themselves a surgical patient, they moved directly into Station 1. And then along the corridor down there that's kind of where we put our ambulatory patients. We soon outgrew the ambulatory patients, including the guy that got shot by the golfing cart or the shopping cart. Ran over to the PEDS ER and asked him, I said, hey, can we use your space? And you. And his eyes went, whoa. So, but they did awesome. I mean, PEDS nurses, PEDS emergency medicine guys, I mean, they took care of a lot of the, GSWs to the extremities and things like that. They did a fantastic job. You can see the stars, that's kind of where we did our supply management. So, of course, we run out of stuff when you see 260 patients. So we mobilized our surge tray. So I thought our surge tray was gonna save the day. We're out of chest tubes, we're out of laryngoscopes. I'm down to like my one last 11 blade, and here comes the supply that's gonna save us, right? So what do you think? I mean, so we normally surge during New Year's Eve. What do you think the supply had in it? Vomit bags, 4x4s, and IV fluids. Perfect. This kind of just shows the location of the operating room. We also kind of discussed here a little bit about how we triage patients into the neuro ICU. We did the same thing with cardiothoracic patients. If we put in a chest tube, they didn't pour out a bunch of blood, they remained hemodynamically stable, we moved them up to the CV ICU, and our anesthesiologists and our pulmonary critical care doctors took it from there. So altered standards of care, and this is one of the pictures of that night, and that was actually kind of early. So radiology, so everything in a hospital is done on a computer, right? Everything. So when you have 260 patients show up to your emergency department and a majority of them need an x-ray, do you see problems with that? Yeah. So the sicker ones were easy. It was the other ones that you needed to figure out what was going on. So we had our radiologist basically just trail the x-ray tech with a Sharpie. So write this down. This is your first tool for MCI, this is a Sharpie. And wrote down their wet reads either on the patient themselves or on whatever documentation we were using on that patient, or if it was something like a pneumothorax, they let us know that this patient had a pneumothorax and we needed to intervene. Pretty awesome. Orthopedic surgeons, they admitted their own patients that night. Pretty awesome. Yeah, they operated all the next day, but man, they said, look, your trauma team's busy, I'm gonna admit my own patients. We talked about the neurosurgeons. Blood bank, man, a lot of these people needed blood and they needed blood right away. How easy is it for you guys to give blood? Bro. These people, some of them didn't even have like armbands or IDs or anything like that. So, we work with our blood bank. We basically just brought blood down to the hospital, down to the ER en masse. Brought O negative, O positive. O negative was given to any female victims. O positive was saved for the male victims. And it was, not JACO approved, but it saved lives. So the Pyxis, again, computer, need an order, need to get a drug, need to have an identification, right? That didn't work. So we had our clinical pharmacist who brought down all the Dilaudid, all the Zofran, all the succinylcholine, all the Tomidate down to the emergency department, and our nurses were able to have easy access to those medications. Easy access to those medications helped save a lot of people. Ran out of ventilators, that sucked. So at about, thank God it was only for about 10 minutes, but you can put 2 people on the same ventilator. I mean, you can't put a big fat guy and a big skinny guy because you're gonna blow the big skinny guy's lungs out. But if you're of like body habitus, like weight, you just double the tidal volume. It's kind of, there's studies on it. And when you train at a place like where Christo and I do, I mean, you kind of come up with a lot of stuff. Challenges in resupply. We were lucky to be part of a hospital system that had 2 other area hospitals that were not overwhelmed. So we were able to get all of their blood, all of their surgical equipment, a lot of their staff, but still we had shortages. So of course, what are our clinical shortages? Chest tubes, we ran out of those easily within the first 60 minutes. So anybody else that needed a chest tube until we had our chest tubes replaced, we just put ET tubes in. But the same diameter, just not as long. Chest tube trays, again, write this down, part of your MCI planning, 11 blade. We ran out of chest tube trays. Most departments have like 4 chest tube trays, right? Then you have to go to the OR. So we just walked around with 11 blades and suture kits. Laryngoscopes, kind of wipe those off and reuse those. Level 1 transfusers, because we prepared for this. But when you prepare for this, the normal preparation is like you're gonna have 20, 40, right? Not 260. So now our planning, our days of planning have become huge now because you're planning for 260 because in a city that sees 40 million people, this is probably gonna happen again. Logistics, we talked a lot about this stuff. Security, big, huge thing. When I walked in, I saw this, there's no way I thought this was one guy that did this from an elevated position. I thought this was gonna be a multi-phased Mumbai-style attack. And first thing I asked was about security. Second thing I was told was Metro was already outside watching people and helping us. So that made me feel a lot better that my staff was protected. Family support, we talked about it in Orlando. The FBI is a pain in the ass, I'll tell you that right now. So, probably about 3 hours after this started, the FBI arrived. And they're like, well, how many people have you seen and how many people have you discharged? Of course, we're seeing and discharging people like, and they're like, you can't let them go. And I'm like, do you see this place? I go, I need to make some room for some people. So, you know, that was an issue, but also family too. I mean, we had, our waiting room was full of family and friends, and I couldn't tell if there was somebody out there that needed help. So we segregated all the family into our auditorium and our cafeteria. We had dedicated chaplain services. We were trying to communicate as best as we possibly could about their loved ones. Unfortunately, the ones that arrived DOA, we had a delay of talking to their loved ones because we had to wait for the coroner, because it was a coroner case, to release the body. As soon as they released the body, we were able to identify the patients and notify those families. Take home on that last one too, I'll have to say, because I actually had to stay and do all the identification that morning. We utilized pediatric nurses in our makeshift morgue to do that. All but one of those people one of those nurses that worked that night and took care of those deceased patients, all but one of them, they've left Sunrise. So pick the right people to put them in the right place. So we can talk about what went well. You know, we have New Year's Eve, we had a British Airways smoke inhalation, we've done multiple drills, so, you know, we were prepared. We had excellent nursing and physician response. That's really what comes down to. I mean, it comes down to the team of individuals that are willing to come in at a moment's notice and work in a state of crisis. Bed flow process was excellent, utilizing the ICU beds with our neurosurgeons, family decedent management, and then staff debriefing. I mean, we had staff debriefing the next morning. It's still occurring in what we call our resiliency center in Las Vegas, that at any time, a victim of October 1 or somebody who worked on October 1 can go into the resiliency center and without any questions and talk to somebody. Yeah, electronic medical record, right? So yeah, so and what else did we learn? Electronic medical records. Who's worked with Meditech? Here, yeah, we have Meditech. Yeah, right. So electronic medical records is basically when it breaks or when it gets overwhelmed, it's like being in an elevator. You can't go up or down. So come up with a system, and what we're doing now is 100% paper charting throughout the entire incident. So now we have a paper chart, which I can document, anesthesiology, surgery can document, nurse can document. We put orders in on this paper chart, and it's like an escalator. It's not as fast, but you can still go up or down. This is an actual of the number of patients that were in the emergency department to when they were registered and verified in our EHR. Not good, right? Another part of that is, you know, look at your trauma names. I mean, we would do trauma and then a first name alias, right? Debbie likes country music because we had like 4 trauma Debbies. So, so now we switched over to a NOAA kind of hurricane style, you know, automatic trauma identification name to avoid something like that. Hopefully, I mean, there's over 1,000, so hopefully we don't run out of names. Lessons learned. So we did have a delay in calling code triage. Communication with staff. We had great communication with incident command, but horrible communication because our emergency department grew 4 times the normal size of the emergency department. And so I had to run from one side of the department to the other side of the department to the other side of the department to communicate with my docs and the staff over there of what they needed. A simple walkie-talkie would have eliminated that. I'm not sure what communication systems you guys have in your hospitals, but I would look at that. I checked my iPhone the next day and I did 12.5 miles running around the emergency department. We talked about documentation, registration, talked about that as well, radiology verification process. Look into that. There's no easy way. We went around it because we got wet reads from on-site radiologists. And then again, I talked about the on-site county and community response management. Work with your other hospitals, work with your pre-hospital providers, work with your law enforcement to come up with plans because those are the ones that help that night. Those are the ones that need to be prepared for the next night. Those are the ones, I mean, it's simple breakfast burrito and a cop, best friends, right? All right, 3 essentials for your MCI toolkit. An 11 blade, a walkie-talkie, and a Sharpie. You can pretty much do anything but those 3 things. Huge response from Las Vegas. I mean, I moved to Las Vegas in the early 90s, and I always thought it was just a community of people from everywhere else. You know, that's kind of the way I always viewed it until this happened. Basically, VEGASSTRONG came out with not even 24 hours. Lines to the blood bank were huge. You know, there was taco trucks and tamale trucks outside the blood bank. Tons of community support from our local hockey team, local entertainers, all the visitors and things like that. Now when you ask somebody, where are you from? They don't tell you, yeah, I moved to Vegas from Boston. They're saying, I'm from Las Vegas, and they're proud. So proud of my city. We're gonna end with a quick video, and we'll give you on your break. Oh, story, sorry, all over the place. So that young lady, I got a call from a friend I went to high school with and said, hey, my partner's, he's a police officer, my partner's fiance was shot. Well, how old was she? Where was she taken? He didn't know. He got back to me and said she's, mid-20s, was shot directly in the back, and had a chest tube. And I was like, she was in hall 2. So I checked on her. It was her. And that was a picture of us in wine country about 3 months ago, and she was 8 months pregnant and just delivered 2 weeks ago. So pretty awesome. All right, hit this vinegar.
Will come when you will have to rise above the rest and prove yourself. Your spirit never dies. Farewell, I've gone to take my throne above, but don't weep for me, 'cause this will be the labor of my love. Here we are, don't turn away now. We are the warriors that built this town. Here we are, don't turn away now. We are the warriors that built this town.
We are Vegas strong.
We are Vegas strong. We are Vegas strong. We are Vegas strong. We are Vegas strong.
We are.
We are Vegas strong.
Well, thank you guys.